All right, let's talk about something that affects every single one of us, the US healthcare system. Now, I know it's a beast. It's confusing, it's expensive, it's a lot. But what if we could draw a map, a clear, simple map to help us see how all the pieces actually fit together? That's exactly what we're going to do. So, to get started, let's just wrap our heads around the sheer scale of this thing. By 2028, the US is on track to spend $6 trillion a year on health. To put that in perspective, that's nearly 20 cents of every single dollar spent in the entire country, all going toward healthcare. It's a massive number. But here's where it gets really strange. This is the central paradox of American healthcare. On one side, we spend more money per person than any other country in the world, by a lot. But on the other side, when you look at performance, things like access to care, fairness, and health outcomes, we consistently rank dead last among similar wealthy nations. So the question is, how is that possible? How can we spend the most and get the least? Let's find out. To figure that out, we have to start by building our map. And the first layer of any good map is understanding the landscape, right? So we're going to start with the what. What are all the different kinds of care a person might need over their lifetime? This whole journey is called the continuum of care. Think of the continuum of care as the legend for our map. It's not just about one doctor's visit or one hospital stay. It's the entire journey, all the health services you could possibly need, from the moment you're born all the way to end of life. It's how everything is supposed to connect. So where does this journey begin? Well, the first stop on our map, the absolute foundation for everything else, has to be prevention. This is all about the stuff we do to stay healthy in the first place, to stop diseases before they even get a chance to start. And prevention isn't just one thing. It really happens in 3 stages. First, you've got primary prevention. That's stopping a disease before it ever happens, like with vaccines. Then there's secondary, which is all about early detection, like a mammogram to catch cancer early. And finally, there's tertiary prevention. This is for when you already have a condition, and the goal is to manage it so it doesn't get worse. Okay, so moving along on our map, we come to a region called acute care. This is what most of us picture when we think of healthcare. You break your arm, you get the flu, you need surgery. It's short-term, intense treatment for a specific problem. It's also where an enormous chunk of those trillions of dollars gets spent. Now, a massive part of modern healthcare, and one that affects millions of Americans, is chronic care. This is for the long haul. It's the day-in, day-out management of conditions that you live with, things like diabetes, heart disease, or hypertension. They can be controlled but not cured. And this is a huge driver of costs and a critical piece of the puzzle. And that brings us to the final destinations on our map, long-term and end-of-life care. This part of the journey covers everything from help with daily activities to palliative care that focuses on comfort and quality of life, and finally, hospice care, which provides compassionate support for people in their final months. Okay, great. So we've mapped out the what, the different kinds of care along the continuum. Now let's add the places, the towns, the cities, the actual buildings on our map. Where does all this care actually happen? Let's start with the big ones, hospitals. Now, who do you think owns most of them? You might guess big corporations, but actually the majority, 57%, are nonprofit. Still, almost a quarter are for-profit, meaning they're owned by investors. And that's not just a piece of trivia. Whether a hospital's mission is community health or shareholder profit dramatically changes how it operates. And how about your doctor's office? You know that classic image of the friendly neighborhood doctor with their own name on the door? Well, that's becoming a thing of the past. The solo practice is vanishing. Today, only about 14% of doctors work that way. Most have joined bigger groups, either with doctors in the same specialty or in large multi-specialty clinics. And I am willing to bet you have seen these popping up all over the place. We are living through an explosion of what's called ambulatory care, basically walk-in care. Urgent care centers on the corner, clinics inside your pharmacy, standalone surgery centers. It's all about providing faster, more convenient care outside of the hospital. So our map is getting pretty full now, right? We have all these different types of care and all these different places where you can get it. But here's the problem. A lot of the time, they don't talk to each other. Your hospital doesn't know what your specialist is doing, who doesn't know what your primary care doc is doing. This fragmentation is a huge issue, and the system is trying to fix it by connecting the dots. And the big idea for fixing it is something called an integrated delivery system, or IDS. The goal is pretty simple, really. It's about getting all those different providers, the hospitals, the doctor's offices, the clinics, to stop acting like separate islands and start working together as a coordinated network. It's about finally building bridges between all the locations on our map. And there are two main ways they do this. You have horizontal integration. That's when similar places link up, like two big cardiology groups merging to become one giant one. Then you have vertical integration. This is when an organization buys up different levels of care, like a hospital buying doctor's offices and an imaging center and a home health agency. One goes wide, the other goes deep. So why? Why all this merging and integrating and restructuring? What is the ultimate goal? Well, there's a big idea that has become the guiding philosophy, the North Star for anyone trying to fix healthcare. It's called the triple aim. The whole idea comes from the Institute for Healthcare Improvement, and they put it perfectly. They said that to really truly make healthcare better, you can't just fix one thing. You have to go after 3 different goals, all at the same time. And here they are. This is the triple aim. 1, make the experience of being a patient better. 2, actually improve the health of the entire population, not just one person at a time. And 3, lower the cost of all of it. And here's the genius of it. You have to do all 3 at once. You can't make care cheaper by making it worse. You can't improve health by bankrupting the country. It's the ultimate balancing act. You might be thinking, okay, that sounds great in theory, but does it work? Absolutely. Take a look at an innovator like Kaiser Permanente. They have a program that uses their huge integrated system to find patients who are at high risk for heart attacks and strokes, and then proactively help them. The results? They've dramatically lowered those events across millions of people. That's the triple aim in action. Or look at Intermountain Healthcare out in Utah. They have built this incredible culture of innovation, constantly using data to figure out how to provide the best possible care while keeping costs down. And the proof is in the pudding. They have some of the lowest death rates from heart attacks in the entire country. So there's our map. We went from the full journey of care, to all the different places it happens, to the big push to connect it all and aim for that triple goal of better health, better experience, and lower cost. It's a ridiculously complex system for sure, but as places like Kaiser and Intermountain show us, it can get better. It is possible. And that leaves us with one final big question. What role will you play in making sure that it does?